All right. So thank you all so much for joining us. My name is Deanna Jones, and I'm the Executive Director of the Thompson Senior Center in Woodstock, Vermont. I'm also very gladly the co-chair of the Vermont Association of Senior Centers and Meal Sites, VASCAMP, as we refer to ourselves. Jenna Claire is my co-chair, and I see several of the steering committee members on as well. So it's good to see you all, and thank you for being here. Our primary agenda item today is to turn it over to our AAA nutrition directors to talk with us about the state plan on, or the area plans on aging. And they'll clarify if they're drafts in some places or approved. So we'll talk about those, how they relate to us, and any impacts that might have on us. And then there are a few other updates. I think John will have some updates for us after that about some training, which we're glad to have him here, and welcome. And then we'll definitely save a little bit of time at the end for any burning questions and answers, how it's going at your senior center if you have questions or concerns. I want to ask, before I turn it over to the AAAs, if Connor has any updates for us or needs to share anything from Dale.
Hey everyone. No immediate updates. I think when we get to the end and questions from you guys or concerns, whatever it may be, I'd just love to hear about what if you're getting any questions about booster shots or people wondering, what's going on there, because we'd love to be able to help support you guys with information as needed to give you the confidence to speak to it, and then what's going on with the health department in terms of how that's being rolled out. And then again, if anybody's having concerns or receiving questions about how to sign up for them, again, we just want to make sure we're clued into that so we can get the information out to you guys and make sure you have what you need, so that way you can get that to the folks with whom you interact. So.
Okay. Thank you so much, Connor. We'll get you questions at the end, I'm sure, but let's turn it over to our AAA nutrition directors to hear about the area plans on aging.
Thank you. This is Chris Moldovan, and I'm going to share a short presentation with you. I'm going to share a disclaimer at the beginning that this is a presentation that we used previously to educate our registered dietitians that work with us. But I think the information is very relatable, and it'll make sense to all of you as well. And if there are additional points or questions, we're happy to take them. I want to say that I am from AgeWell in the Northwest area of Vermont. And maybe each of the directors, if you could just introduce yourself if you're on the call, and then Kathy Paquette and I will do the main presentation.
Everybody, I'm Wendy Germain. I'm with Senior Solutions, and we cover the southeastern part of Vermont, so Windsor and Windham counties.
Hi, I'm Madeline Gardner. I'm actually the Nutrition and Wellness Coordinator for the Southwestern Vermont Council on Aging. I'm stepping in for Courtney Anderson. She actually is on maternity leave until December. And I'm with, my service area is Bennington and Rutland County.
Hi, I'm Herbert Will. I'm with the NEK Council on Aging with Northeast Kingdom. This is the beginning of, well, the middle of my 4th week. I'm kind of still coming up to speed, but it's great to see all this participation. I'm glad to be here.
All right. Oh, sorry, Kathy.
I'll just speak along with Chris. So I'm Kathy from Central Vermont Council on Aging.
Hi, I'm Mary Ann Beaupre, and I'm from the Greater Northfield Senior Center, and I work in Northfield and Berlin and Riverton and the whole area here in Central Vermont.
Thank you.
I think we're just gonna
Oh, go
go
ahead,
with,
Kathy.
I think we're just going with the AAA directors introducing themselves.
Yeah.
So that you're aware of who we are around the state. And then we'll go into our presentation and then we'll hand it back to Deanna for other questions and intros, okay?
Thank
In
you.
the interest of time, thank you.
Yeah, thank you, Kathy. So what you just heard was you saw representation from all areas of the state of Vermont. Can you all see the slides at this point? Okay, so you can see that each of the AAA's, area agencies on aging, serve different towns. And as part of the work that we do as agencies on aging is we are asked to create what we call an area plan for our agencies. And this area plan is in compliance with the Older Americans Act. So I'm going to show a couple slides that talk about the area plan and the process, and then we'll go into the actual measurable measures that we need to be thinking about in terms of our projects for the years to come. So basically, as I said, each area agency on aging is a recipient of Older Americans Act funding. And many of you have heard that term before. And what that means is there's a federal grant that provides us with dollars to support nutrition programming, whether it be home delivered meals or community meals in our areas. The area plan is written at the agency level. So there are 5 different area plans and the process is all the same, yet the end product is slightly different. So I just wanted to share with you these thoughts. It talks about here that the area plan for 2022 to 2025 is the current area plan. We just started as of October 1, our fiscal year 22. And the last year or so, each agency has been building what that area plan will look like for the next 3 years. So we look at all of our programs, whether it be nutrition and home delivered meals, or maybe it's care and service, or maybe it's down to things like emergency preparedness. There's lots of pieces, and I'll talk a little bit about that. But we're gonna focus in, laser focus, if you will, on the nutrition aspect. But the area plan is created every 3 years, and it's a thorough plan, and it's looking at how we will carry out the work that needs to be carried out in our areas. And again, maintain compliance with the Older Americans Act. This detailed plan encompasses the entire agency's programs. And I'm sorry, 1 second here. And it clearly states goals and objectives with strategies to achieve these goals. This includes not only measurable goals and progress reports on those specific goals, but updated policies, procedures, organizational structure within the agencies. As I mentioned, emergency preparedness, that was a huge thing this year, thinking about how in the last year and a half, our emergency preparedness plans may have changed to respond to the pandemic. And it helps the organization successfully navigate through that 3-year time frame with. I pulled this next slide directly from the Older Americans Act policy and procedure manual for the state of Vermont. This was newly updated as of October 1st, 21. And basically it talks about what is required in the area plans. Area plans will include a needs assessment. We need to understand the needs of the people we serve. So each agency does their own version of a needs assessment, talking to clients, individuals who would be working with our organization, and trying to look at trends and look at the most important aspects of the needs of the individuals we're serving. We also need to include assurances that the AAAs will set specific objectives for providing services to older Vermonters who are at greatest social and economic need. They may be at risk for institutional placement. They may be low-income minority individuals. They may be limited English proficient, so they don't necessarily speak the language or understand the language if it's in written form. And they need to be, we need to be addressing those that reside in rural areas, which is much of the state of Vermont. The area plans must also include proposed methods to achieve these specific objectives. So we need to be thinking about objectives, performance measures, and proposed strategies to achieve these objectives. The assurances need to, include things that are in compliance, certainly with the area plan instructions, but to make sure that we have a plan and we have a way to carry out what it is we've proposed in the area plan. Information detailing how the AAAs will coordinate activities and develop long-range emergency preparedness plans with local and state emergency response agencies, relief organizations, local and state governments, and any other institutions that have responsibility for disaster relief delivery. And then if there's something that is going to go in a different direction as far as offering and providing direct service, a waiver needs to be submitted and approved by the state of Vermont. So these area plans are, proposed plans that each agency produces. We submit them to DALE, Department of Aging and Independent Living, and their team, the State Unit on Aging, reviews, makes suggestions, comments, needed revisions, sends them back to the AAAs. They then in turn will revise if necessary. And then once that final version is submitted, it gets approved by DALE. And that is the plan that the AAAs will work towards in the next, for us, in the next 3 years, in that 3-year period that's designated by the area plan. So with that, I want to just explain a reference that you might hear, something called the RBA, or results-based accountability. So we talked about measurable goals, right? We want to be making sure that the plan that we make is achievable, but we know how to measure that we've achieved those goals. So it's a system to help the AAAs and other organizations improve their effectiveness of their programs. They're data-driven decision-making processes. So oftentimes you'll hear, and you'll hear in a few moments, how we're going to be measuring number of people served, percentages of people served, and meeting certain standards. So Kathy, with that, would you like to take this one?
Sure. So hold on, let me just get myself in a position here. Okay, so with that, we're going into the actual 2 goals for nutrition for those 3 years. It's strengthening the base of the goal is to strengthen the core Older Americans Act services that support the older Vermonters at greatest economic and social need. And we focus statewide with Mary Woodruff's input as well at DALE around these 2 objectives. Nutrition counseling, there's a definition here as to what nutrition counseling is. It's defined by the Nutrition and Dietetics. It's individual guidance to, that's kind of redundant, but individual guidance to individuals or caregivers who are at nutritional risk because of their health or nutrition history, dietary intake, chronic illness, or medication use. Counseling is provided one-on-one by a registered dietitian and addresses the options and methods for improving nutrition status with a measurable goal. and it's key, this measurable goal. That's a standard practice with dietitians, but it's clearly written that we make sure we have that and understand that. We have the number and percent of older Americans Act Nutrition Service Program is the acronym that we're looking at. NSP, participants with a nutrition risk score of 6+ who are referred to nutrition counseling and set a measurable goal. So that is really what we're measuring. We are going to, as you know, we have at both levels of the home delivered meals, well, all three actually, the grab and go meals, the congregate meals, and the home delivered meals all have an intake, right? And that intake includes nutrition screening initiative checklists. If it doesn't include it at the provider level, it is used at the Council on Aging or the Area Agency on Aging level. So everyone gets a score from that nutrition screening. And then this is what measures who is referred. Okay, how many people are referred? And how many people receive that measurable goal? Anything else, Chris, there?
No, I think what we'll be doing is as AAAs, each of the 5 will be looking at it slightly differently, but we'll be reporting on those end results. What will happen is each agency will submit their findings, and that in turn, Dale takes that information and creates a statewide plan, right? And a statewide report as to how we're doing and how we're serving those clients highest at risk. So we'll be looking at the number of individuals who score 6 or higher, get a nutrition referral from medical nutrition therapy through a registered dietitian at the agency, and those people then set a measurable goal to show improvement in their nutritional health. And this
Spoken
is
like
the-
a dietitian. So,
Can you just take that one step further before you move on to the next one and tell us how it specifically relates to senior centers and meal providers and what our role is in that, or what you feel our
Sure.
role is?
Sure. Good question. So I'm not sure how it works in other areas. I'm going to speak for Central Vermont Council on Aging. We have partners, 12 of them, a lot of them are here, thank you, that provide an intake at the congregate level, at the grab and go level, and a Meals on Wheels intake. The Meals on Wheels intake in our service area does not provide the nutrition screening initiative checklist. So I'm just going to talk about the one that does provide the what we call the NSI. So when someone receives a meal, they're supposed to be registered through these intakes and fill out the paper information at the site level in our service area. Then it comes to the AAA, and we enter it into a database and do the referral pieces.
Yeah, and Kathy, I think that's similar in many areas, with at Age Well, we don't call them intakes, we call them registrations, same thing. But basically it's a 2-page form where people are filling in their demographic information that we need to, again, report to NAPAS, but demographic information. And as part of that, there are those 11 questions that NSI checklist are: do you eat alone most of the time? Do you take 3 or more medications? Do you, there's 11 different questions, and then a score is created. So that information, when the AAAs are reaching out to you at meal sites or you at other partners, we're saying, hey, we need to have these completed. That's the part that's very important for us as AAAs, because you're gathering that data, submitting it to us so that we can analyze it, and then again, make the referrals when those are appropriate. Wendy, did you want to chime in on anything specific to your area?
No, it sounds like we pretty much do it the same way. We have some sites do their intakes themselves, and then others just utilize us and the helpline and do it that way, but all of our intakes include all the survey questions, so they'll get their nutrition score. So.
Yeah, thank you. And the other thing I guess I'll just add, Deanna, and this might be helpful for everyone to understand. So each agency contracts with a registered dietitian to provide one-on-one medical nutrition therapy and counseling. And as part of that, you know, it could be a referral made to someone who's having trouble managing a chronic health problem like diabetes. Maybe their blood sugars are out of control. They're not feeling well. They've been to, you know, multiple doctor's appointments and their medications are being adjusted left and right. And the dietitian could actually work with that person to maybe manage the foods that they eat and the snacks that they plan to eat throughout the day to manage their blood sugar more efficiently. Or maybe it's someone who's having a problem maintaining their weight. Their appetite is poor. Maybe they have poor dentition. Maybe there's some other chronic health problem, and they're on multiple medications, right? And they're not able to eat enough food. And so they're slowly, progressively losing weight or becoming weaker. Or maybe it's a situation where someone has recently undergone a surgical procedure and had, say, a knee replacement, or they have a pressure sore that they can't heal. They're not able to you know, effectively recover from that. So the dietitian could work with that individual to talk about ways to include more protein in their diet and help them, you know, improve their status. So the goal, again, and how it would affect senior centers is we're serving the population you serve, and we're asking and working together as partners to get the information we need as AAAs to make the referral to that dietitian so the dietitian can actually help and provide services. Is that helpful?
Yep, thank you for just making the connection for all of us.
Sure. And this is the second goal, is working around therapeutic meals. And it's defined as meals that are approved by a registered dietitian to provide specific nutritional requirements that address an identified disease, clinical condition, or nutrition diagnosis. And here again, it's about numbers and percent of people, of local service providers in the AAA service area that have one or more therapeutic meal options on their daily menu. Now, to follow up the way, how does this affect you? So you are the local service provider for meals, and you, at this point, probably most of you only have one choice, or are specific to certain people's needs, but are not really supporting a therapeutic meal. So that's, it really is about, are you ready as a local service provider to go to the next step of saying yes to providing therapeutic meals? Because we are setting up the system that helps to support you to do that. We are looking at software at the AAA level. We are looking at for specific, to analyze your recipes and then to make it work with the dietitian around that client's needs, or that actually is not the client's needs, it's the dietitian, the chronic condition that we're working on. So that number would be, okay, out of 12 sites, I have one this year that's ready to go forth. And we'll work on how do we do that. So it's all a step process on how you work forward with that. And it really is about, is that local service provider ready? And then the next part of that is the number and percent of Older Americans Act participants who receive a therapeutic meal, who self-report the meals provided by the local service provider, help them eat healthier foods, improve their health, and or feel better. So it's a survey that we would provide to those who are on, and we have here the survey. So quite simple of who, you know, if you are receiving a therapeutic meal, you'll receive a survey to let us know that we can record that it makes a difference.
And again, how this might, you know, how it might impact the senior centers or the partners, I think it's yet to be determined at each AAA level. We're, you know, working with different partners to do different things. As Kathy said, in her area, she has 12 providers. In the Agewell area, we have one main food service provider, but others have different situations. So as we gather the information that we need to report and we move in that direction, working with our partners, we may be talking to each of the meal sites saying, hey, can you help us get these surveys out? Or we might be doing a direct mailing to that client to understand if the impact of the therapeutic meals are in fact helping them eat healthier foods, improve their health, and feel better. And, you know, again, these measurable goals and these results will be information that we can share, you know, so year one, we'll have a baseline piece of information and be able to share that with other partners in the future. In year two, hopefully we'll see an improvement from there. You know, the percentage of people saying the therapeutic meal perhaps helps them eat healthier foods, that may indeed show a progression over the 3-year period. And at that point, we'll be charged as a AAA to rebuild a new area plan. And the direction may be to build on this RBA, you know, this measurable goal, or it may be to focus on something else because we've mastered this area. Any questions?
Do you want questions on the specific one now? Shall we
Sure,
open it up for that? Okay.
sure.
So everyone, you're welcome to unmute yourself if you have a question, or raise your little yellow hand if you'd like to do it that way. But let's have questions about this particular goal, if there are any. Well, I never don't have a question, so you'd be disappointed if I didn't. So I mean, having run a medically tailored meals project, a pilot, and that included breakfast, lunch, and dinner, and was for people with heart issues, so no sodium, low sodium. I know there's a couple of things that sort of jumped to my mind with this, and I was glad to hear you say you're looking at software, but I'd wonder about the assistance for meal planning and how this affects menus and meal plans and the guidance related to that, or if it would be up to the individual organizations to work with their specific dietitian. So that's part one. And then is there potential for additional grant support for increased costs related to this? I mentioned ours was breakfast, lunch, and dinner. So there was, you know, certainly increased costs related to our specific one, but you know, we were buying some separate products specifically for people on those medically tailored meals. And can you clarify if medically tailored meals is different from therapeutic meals in your definitions?
So that would be the easiest one to answer, I think, is the medically tailored meals definition is stating that it is a prescribed diet by a physician. Mm-hmm. So at this moment in time, the AAAs are not able to work directly with physicians to get a prescription for a specific diet. So the term therapeutic diet or therapeutic meals is very, very similar in that nutritionally, it would be providing support meals designed to help individuals manage a chronic illness without being a prescription. So perhaps a person could, you know, call in, ask for Meals on Wheels, say, I have diabetes, I would like a diabetic friendly meal, or whatever the terminology is that you might use. And so that would be considered a therapeutic meal as opposed to a medically tailored meal prescribed by a physician, if that's helpful.
Thank you.
And then your other question was supports. I think that each agency does have a registered dietitian. We have been all, at least one, some of them have a couple who do consulting work. And we at the nutrition director level have been working really closely with those dietitians to help them understand what our goals are. And some of them do menu review and work really closely with some of the kitchens and cooks, and that's going to continue. They may have to work a little bit more intensively if a particular site wants to pursue one or more therapeutic menus, and we are prepared to help support that as best we can. I think that the exploration of the database, as Kathy mentioned, is a first step. We're understanding what's out there, the tools that might be helpful, but we're not quite ready to jump and say we're going to go ahead and fund this at each site and make sure that everyone has access, because we want to find the best product that makes sense to help and support each of you to do that type of work. Kathy, was there anything else I didn't say in response to that?
No, I think you covered that. Was there another question, Deanna?
Well, the software is potentially something that sites would have direct access to, not just through the dietitian, or would it be through the dietitian and AAA's, or is that unknown?
Unknown at this point.
Unknown at this point. I mean, we're
Okay.
just discovering what this detail.
Sure. And then
Is-
about the expense related to creating different meals, therapeutic meals? Are there additional grant potential if people have additional expenses to create therapeutic meals?
I don't know if Connor or maybe Mary Woodruff, if you're on the call, I thought I saw Mary. If you want to address that at the state level, or I'm not aware of any additional funds at this moment is my answer.
So the question is really then if the sites can absorb the additional costs of creating multiple therapeutic meals and want to be participating in that too.
And the question would be, is there a cost, an extra cost as well? So if the menu is made, created with the help, and there's a cycle menu, and it's part of the same buying process, then is there an extra cost? Yes. So that would be part of the process of learning of what is this going to cost? Is it going to be more? Does there need to be a different budget for providing these and support for that as well?
And I think the other thing to think about, as a group, is each AAA service area functions a little differently, as we said, and each site within those service areas function a little differently. So each site is going to understand what they can manage or not manage, right? And they'll attempt or not attempt certain levels of these therapeutic meals. So I think that, by working really closely with your designated nutrition director at the AAA, we're going to offer you as many supports as possible and help understand what you can accomplish and want to accomplish as an organization. And we're going to work together to see how we can meet these goals. And I do want to go back. I think I did not address this, Deanna, you mentioned this in the introduction. And again, if Connor can verify, I believe all of the area plans at this point have been approved and are moving forward. As I said, our fiscal year is October 1. And I believe, as in the last weeks or 2 or 3 weeks, things have been finalized and approved so that the area plan is good to go at each of the AAA levels.
Yes, yeah, I can confirm that each of the AAA's area plans have been approved. I think also, from our SUA or state level perspective, is that we're only going to be as good as the planning that goes into these things. So keep in mind that the planning it certainly doesn't end at the area plan level, right? These are like, this is the high level, this is the visionary. This doesn't really get into the tell you the specifics of the hows, of what's going to be the specific efforts that lead to each of these objectives and these goals being achieved. And so, to your point, Deanna, about some of these questions, this is where, the needs assessments and a lot of the initial environmental scans that go into this identify sort of, again, these high level, these broad level needs that we want to try and tackle. But now it now moves into that sort of next level planning of like, now we're down into the planning with the service providers. Now we're down into sort of the action of it. And thankfully, these are not 6-month, 1-year plans, right? These come with the time to allow for those details to be worked through, and for strategies to be put in place about what are the training needs to get a site to a point where it understands how to put together therapeutic meals. What are the ingredients that are needed on top of what's already there? What does that mean for possibly increased services or supplies? And again, those questions that will all need to be addressed in terms of putting this together. And then, looking at it from, of course, the cost benefit analysis side of things of, okay, what, with the cost of these things, then what is the benefit? How many people are being served? What is it going to do for them? And continuing to measure those kind of outcomes of the efforts and using it as an opportunity to try and improve the system and improve the health of the consumers who are utilizing the services. And, I think in terms of then, as you look at what the funding sources are needed, that's when we look to what we have for the OAA funding, that's baseline. We look to have what we have in additional for our American Rescue Plan funds, which are through 2024. We look at if we are moving into therapeutic meals, does that open up the avenues for different, more donors, different aligning with different philanthropy, and just seeing what doors and opportunities it can open. And so I think that's really, to just support it back up what Kathy and Chris were kind of saying with the plan. But again, I don't want you to think of this is going to start tomorrow. This is like, there will be many layers of planning to go into this.
Thank you. Did you have one more slide, Chris?
Actually, it was just the helpline, just letting
Okay.
people know that, if people do have questions and aren't sure how to reach the area agencies on aging, the 1-800-642-5119 is the helpline across the state. And so, all of you could access us through VASCAMP, through Deanna. She can hook you up with the right nutrition director. But if you did want to call the AAAs, you could reach us through the helpline.
I just put it in the chat for everyone.
Thank you. Thank you so much for the opportunity to share the area plan and the process. We're certainly able to continue the conversation, answer questions in the future. Let us know what you need, and we will be communicating with each of you in our service areas as we work towards these goals from 22 to 25.
Thank you.
Good. Thank you. That was very succinct and informative. Are there any other questions for Kathy or Chris on that? All right, seeing none, I think we'll turn it over to John. John, did you want to talk to us about what you have on your mind?
Certainly do. Thank you very much. Hello, everyone. I don't know all of you. I know some of you. John Mandeville is my name. I'm the executive director at CVCOA. been on the job now for just about exactly 3 months. I do not come from a background in the aging services community. I come from a business and business support background. I was the executive director for the Lamoille Economic Development Corporation for 11 years before going into retirement, and 1 month later starting here. So it didn't last very long. Anyway, I can't tell you how happy I am to be in this position, and looking forward to helping to have CVCOA thrive and prosper and to continue to serve our mission. One of the things that I had done in my previous life, which I want to talk with you guys now, is for about 11 years, I put together and ran a fairly robust workshop program. These were workshops that were aimed at small business owners and small business managers. They were on very limited topics that were specific interest to that particular group. We put on 8 of them a year. And once they started getting the reputation that they got, we were getting anywhere on the low end, we might have 12 participants. We sometimes had as many as 50 participants. And these were all in-person meetings. We didn't do Zoom in those days. They were extremely well received. It occurred to me that the same concept could be brought to bear in helping all of you to fulfill your needs. I've run this idea by my fellow directors at all the other AAAs. They have agreed to move forward. We'll seeing if we can put a framework to this that works for everybody. Essentially, it'd be pretty much the same as what I described I did in Lamoille County. We don't know exactly how many workshops yet because we're just putting this together, but the hope would be that we'd be able to provide enough workshops over the course of any given year to be of real value to this community. And they could, when I was doing this for small businesses, we were doing such things as how to read and understand your organization's financial statements, how to do inventory control, how to properly and efficiently do digital marketing online, using mobile phones for marketing purposes, how to hire right the first time, legal issues in HR. Either those same kind of topics or very similar topics I think could be very well received with this group. And we can customize them any way we want in terms of topics. But that brings me to one of the main reasons I wanted to talk with all of you is topics are the important thing. If we're going to make this work and make it as valuable as possible to this entire community, we need your input. You need to get back to us, get back to me, and let me know what topics would you like to see covered. And we will be trying to put that together over the next several weeks. But without your input, it doesn't really make a whole lot of sense to try and make this work on our own. So I'm asking you to please, either yourselves and all the nutrition directors in the AAAs around the state, send me some ideas. Send me some ideas for workshops that you would love to see put on. And if you have ideas as well for a facilitator who might do that workshop, that might even be more helpful. But the idea is that this would be done through the V4A. It would all be organized by us. We would put them on. We would arrange for the facilitators, the whole shebang. And the good part about it too is the intention would be to tape all of these and create a library that can then be used in the future for any new people coming into this area, any new nutrition directors, any new Meals on Wheels people, senior citizens people, boards of directors. This could all be used as a future training opportunity moving forward. So that's what we're trying to do. And your help will be very much appreciated to help us make it happen.
Thank you, John. That's a fabulous idea. I love it. It plays right into the goal that VASCAMP has had for some time to develop a toolkit to support senior centers and senior center directors specifically, as you know, those positions turn over, and for staff development. I think it's a wonderful endeavor.
Well, thank you. I am looking forward to making this happen. I think it's an exciting opportunity and a win-win all the way around, I think.
Yeah. If anybody has ideas that are fresh on their mind and they want to share it in the chat, we'll save the chat and send it to John. Or they can, do you want them to message you directly or?
Yeah, they can, if they like, they can email them to me directly or to Kathy. She'll pass them on to me.
Okay,
And this, bear in mind, this is not looked at as a one-shot thing. We're looking at doing this as a series of workshops that we can present over the next several years. And some of them might repeat from one year to the next because they're such hot topics, but there obviously would be updates. I mean, I can think of, workshops that could be appropriate to this group on legal issues involved with working with volunteers. What is a board's responsibility in this kind of a nonprofit environment? The topics we could cover just kind of goes on and on.
great. Thank you very much for bringing that forward and sharing with us.
You're welcome. Thank you.
Any questions for John before we move on to our next and final segment? Okay. So what we always do on this monthly meeting is share where we're at. If there are struggles or challenges or successes that we want to celebrate, any questions for the state, concerns that you're having at your centers, particularly related to COVID or anything along that lines, this is where we open the floor to everyone to discuss. So a last bit of a roundtable is what we do. So I'd like to open it up for discussion. How's it going, everyone? I'm going to be quiet now. Don't make me call on you, Mark Bradley.
I'll start. Things are going well. We are just getting busier and busier. I think about a month ago, we kind of had to do a little bit of reinforcing of our mask mandate. We're really trying to keep as many activities going as possible. But people have responded well to it. There's a few that I think are holding off either because they don't want to wear the masks or they're still nervous, but numbers keep inching up anyway. Other than that, we're launching a new website, going into fundraising season. Just started our new fiscal year, so I'm sure there's a lot of accounting fun to be had in the days coming up. Yeah, I don't know. Things are really humming along, and morale is very high among staff and our seniors here.
I'm happy to share an update from Montpelier. We've had a lot of exciting staff transitions. Sarah Lipton, who had to hop off, started as our new director, and I'm in a different role supporting the senior center and our parks and recreation now. We've got Maddie Scholar, who's on the Zoom with us. She's our new AmeriCorps member, supporting our senior meals and our kind of village-related services, MSAC at Home, that we're developing. And Sarah's position got filled by a new Feast senior meals program manager, whose name is Kim Myers, and she'll likely be on a future call. So we're also redesigning our meal program to bring in our own chef for the first time. Our program has worked with an outside contractor for the last 8 years, and we're really excited for this change. We're also going into a busy fundraising season. We're making a lot of adjustments in our facility to kind of make things run more smoothly and just kind of our systems overall. And we're just kind of continuing to manage how much online programming people want to do versus in person. We've got a mask mandate in our facility and are doing about 5 or 6 indoor classes this fall and about 25 online weekly. And then we have started up hosting Osher again. We're limiting the numbers, but we've got about 30 people coming in for those lectures. We're continuing to do just curbside meals and hopeful that maybe later in the fall or in the winter, we'll be able to come inside, but we're not doing that at this time. And we continue to have groups of people meeting outside for walks and other activities, and a couple classes are still meeting outside. So it's a busy and exciting time, and it's nice to see you all. Thanks for coming together.
Hi, Robert and Kathy from Danville. We, Kathy and I have been on vacation, our first vacation that we took since I started there, almost 2.5, almost 3 years ago. And even though we only work 2 days a week with the meals, but we're there pretty much occupied 7 days between shopping and prep and everything else that we do. But we're getting ready to go back tomorrow, our first day back. And yesterday we stopped by there and we found out that the stove was down, that the dishwasher was down, and that the telephone system wasn't working. So it was like, oh boy, maybe extend the vacation for another week. I don't know, but we got the telephone up and they fixed the stove today from the gas company. So the machine is just down. But we too are also only doing curbside and delivering meals to homebound. And that's going well. We've seen numbers increase slightly. We tried to open the dining room back in July, but it didn't work because we didn't get that many people. And then all of a sudden the variant really started, it seemed like, to kick butt. So we're watching the numbers and we'll decide later on, I guess, in the fall on whether we can close and go with that. But we're excited to go back there, and we're excited to, well, I'm excited to meet, we're both excited to meet our a new addition, and we got lots of problems to throw on your shoulders. So, but that's it. Thank you. This has been a great meeting. Thank you.
We have an appointment on Monday.
Yeah. We'll be there.
Thank you. Lori?
Hi, I can share. So in September, we started back up our normal activities, strength training, chair yoga. We have shuffleboard, cribbage. We started asking that folks wore a mask because around town here in Springfield, numbers were going up. People were starting to wear a mask. Now we are requesting the town, our senior center is under the town of Springfield, and the select board met and they have required that all masks be worn in public town buildings. So we require that you wear a mask. And I've only had one that didn't want to really comply, but they do now. But everybody's been wearing a mask. We don't have our Wednesday afternoon activities, which would draw more folks in. We're canceling our Christmas bazaar we usually have that in November, and that's really popular, but there's just too many people, and Springfield's been hit for a little while. We've been hit pretty hard. The schools, we had 200 kids out quarantining at one time. So we're just taking it easy, but all these folks, some of them have already started getting their third vaccine, and of course I can't ask, but they're so excited to get it, and others can't wait for when the Moderna gets it so they can get theirs. They're getting their flu shots. We have the fans going, air purifiers, things to make, they're just happy to be out.
I just had a quick question if people could address whether there's been COVID positivity that's happened in their facilities because of continuing to operate, or whether it's among staff or participants.
I can answer part of this, and in Northfield here, we've been guardedly doing a few activities. We have required that anyone who does not have their full vaccine wear a mask, and we've had no problem. I knock on wood, which makes me my head at this point, but we have not had a case out of the center or anyone in the center sick, so we lucked out. I don't know. We purchased one of the sanitizing foggers, and I have my janitor come twice a day, and he fogs the building. So that also could help, and that was a pretty dear expense on our part, but it seems to be helping us out. So I'm happy. but happy. Our cook has been on vacation, which means I cook and direct at the same time. So I got 3 more days and I'm all done cooking. Not all done with the center, but all done cooking. So, yep, we're doing good.
Good. You made me nervous there for a minute. 3 more days. No issues here with COVID amongst staff or participants. Knock on wood. We are open for meals in person, and we're still doing curbside and home delivered. And we've had programs. We are having programs inside and outside, and people are so grateful to be back. We do see fewer numbers, but one thing that's been really successful for us is the hybrid programs we allow people to be in person or online for any program. And we purchased with some of our grant funding, something called an OWL from OWL Labs. And it's a really powerful microphone and camera that turns to see whoever's talking. And it's really kind of cool it makes the technology piece easy. So it connects to any Zoom, and it allows people to really see who's talking and hear well. So we're thankful for that. We have a drive-through flu clinic with the VNH. People are asking about the COVID boosters, and similar to what Lori said, those of us that had the Moderna are wondering about that. So everyone's just sort of waiting and watchful waiting, I think, for a lot of things. We had a really cool program this month we called Shark Tank, and we have met this group of sort of inventors and entrepreneurs that want to get feedback on their ideas. It's not a solicitation in any way, but they share their ideas with a panel that we call the Sharks. And the seniors then give all their feedback, and they loved it. It was really fun. And it's a really exciting prospect of being part of creating something that becomes a product out there in the market. And they're really focused on aging and think that products for older people should not be brown, beige, and boring. And so they're a fun group, and we're going to start that as a series, with potential to grow to other senior centers that might be interested someday. And we're also participating in the Guinness World Book of Records for bingo on October 22nd, and you can still sign up for that if you want. But that's home or in person too. So everything we're trying to keep our options open for people. But that's what's happening with us. We did put in place if you're a staff member, you need to have vaccination as a requirement of employment. So that was a new policy we implemented this past month. But that's what's happening with us in Woodstock. What's happening in the Northeast Kingdom, Melinda?
So our Meals on Wheels is still very busy. Our congregate meal site is open. Definitely not as many participants as we're used to from last year. We used to, in the summer, have at least 50 to 60 people per day. And now we only get like 15 to 20. But those 15 to 20 are mostly residents of our facility. And so since we haven't had any COVID cases at or within our facility, we're keeping it open because those residents are just so happy to be able to get together. We don't have any activities other than the meal site happening right now. We're going to try to get something going this fall, winter, depending on how COVID is there's a lot of COVID cases in the schools here. So there's definitely a lot of COVID going around. So we're trying to be very cautious right now. So we're moving along, but slow and steady.
Thank you. Kathleen or Jean or Joanne or anyone else who hasn't shared an update, would you like to? You're muted, Jean.
Hi, this is Kathy from Richmond, Huntington, Bolton, and we are requiring masks also and having some, of course, outside activities are going on as long as possible. And we don't do any meal service, but we also are doing, continuing with more online kind of activities and programs as available. So I'm not aware of any COVID cases of seniors, but I know that I don't see my grandchildren often and they get sent home with, they get it sent home on like today, you know, there was a classmate next, you know, sat right next to my granddaughter. So she's in now until she gets a negative test. So that's just ongoing in the schools. Yeah.
We're right online with other centers, I think. We have curbside. We're going to have next Friday to-go barbecue. And we have volunteers that are going to come and cook the chicken. And
that's a good idea.
Yeah, and we do have some great deck furniture and outdoor furniture. So if the weather's nice, then people will, you know, are welcome to eat there. No inside dining. We tried that and it wasn't really very well attended. And we're having our kitchen renovated. So it's a good time for us to do that. And we do have small groups that meet, bone builders meet. It's like everybody says, it's coming along, but it's different, that's for sure.
Great. I think I'd love to offer Mary, our new director at V4A, or Mary Woodruff, anyone else that hasn't shared, to take a moment before we end.
I just wanted to share that we had our first congregate meal on Monday and our second one today. And it's been a challenge because, you know, of all the sanitation requirements, but when we were having our outdoor picnics, we were having 50, 60 people. And now we have, you know, maybe 9, 10 people indoors, which is, we expected that. There are some people, and many of our members are still concerned about going inside. We have moved all of our exercise classes inside. And again, we've lost a few people because of that, but with the weather approaching, cold temperatures, we thought we needed to do that. And we were also doing some work on our pavilion, our outdoor pavilion. So it was necessary for us to move them inside. So we are encouraging people to wear masks. We're not requiring it, but we have been able, as I said, to bring back all of our exercise classes, our Tai Chi classes, better balance, bone builders and so forth, yoga class. But we aren't seeing the numbers, and we just hope that over a period of time, those numbers will increase as we're able to control the virus more and as people become more confident about being inside. So it's a walk before you run, but it's a step in the right direction. At least we see things happening, and the people who come all say how happy they are to be able to be with other people. So we have to be patient with the numbers, I guess, but we're getting there.
Hi, I'm Mary Woodruff. I'm from Dale, Indiana. Thank you for giving a moment to speak. I'd like to provide an update on the work of the mass feeding group that
Mary, you're frozen. If you can hear us.
And today we met and I was really encouraged to hear partners that are in this group, which include state departments and agencies, but many charitable and nonprofit partners mention that we need to start looking at older adults and thinking ahead to what may happen next, which, you know, is a $25,000 question. Nobody knows. But take from the lessons learned over these last 3 years, assess what's made a difference, look at the data that we have, where have we been, and be able to plan strategically to meet any needs that may come up moving forward. So as things develop as part of that group, I will make certain either to come back and share what I know with you or share it with Connor or the AAA Nutrition Program directors. But it's always nice when, you know, you're the only one at the table that represents older adults. And when the others start saying, we need to start planning. And I was really encouraged to hear that today. So I look forward to sharing more about what comes out of that group. And the second development that came out of that group today was really an interest on behalf of UVM Center on Food Systems, their Associate Director, Meredith Niles, who's done a great deal of research in Vermont on food insecurity and looking at populations that haven't necessarily received the same sort of analysis of their food security and nutrition security needs. So that also may come out of this work group. So I'll keep people informed. Thank you.
Thank you, Mary. Mary Hayden, do you want to introduce yourself?
Sure, I'd be happy to. Hi, everyone. My name is Mary Hayden, and I am the new Executive Director at the Vermont Association of Area Agencies on Aging, fondly known as V4A. And I was employed with the Central Vermont Council on Aging for 5 years as the Communications and Development Director. So thank you for inviting me to this meeting, and it's been very helpful to hear from so many folks, including the nutrition directors. And I also needed an update on area plans, so thank you. It's good to be here. Thanks for inviting me, Deanna.
I'd love to hear from anybody else that would like to share anything or has anything on their mind or questions. We're all talked out. All right, I guess that's a sign. So I really appreciate all of you participating and those watching the recording later because you have a conflict at this time. Thank you for being engaged with the network. I had one suggestion come through VASCAMP this month about sharing newsletters with each other and or joining each other's Facebook pages. It's a great way to see what's happening around Vermont, and most of us have Facebook pages, and I think all of us have newsletters. So please feel free to share those with this list. We have months where the email list is very active with questions and discussions, and then other months when there's not much happening on that email list, but feel free to use it that way and share. Usually we suggest people BCC people when they're sharing with a bunch for the newsletter and that kind of thing. I don't when I send out the notice for this meeting so that you all will have each other's email addresses. So thank you so much for your participation in any and every way. And we'll see you again on the first Wednesday of November. at 2 o'clock, and I'll send out a reminder about that as well. If there's nothing else, we'll say thank you and farewell. Keep up the good work. Bye.
Bye.